Welcome to the Suicide Prevention Series brought to you by the Public Hospitals Authority. September has been marked as Suicide Prevention Month, and so today we're talking about how we can create change through action. The root causes of suicide are complex, but one thing that is not complicated is that mental health concerns can affect anyone, young or old, rich or poor, man or woman. So, how do you know if you or someone you love is struggling? What resources are available, and where do you go for help? Joining me now is Dr. Petra Forbes, who is the Psychiatry Registrar at the Sandlands Rehabilitation Center. Dr. Forbes, welcome to the show.
Thank you for having me.
Thank you so much for being here. So tell me, in your professional opinion, why is addressing mental health and issues of suicide so difficult for women specifically?
So generally, suicide and mental health is stigmatized in the Bahamas as well as the Caribbean. And the issues that women face are unique to us. Women suffer from domestic violence more than men do. We carry babies, right? And having babies is associated with hormonal imbalances, and individuals can have baby blues or postpartum depression or postpartum psychosis, and that's unique to us as well. Women, we also suffer from childhood sexual abuse, right? And that's not talked about often, and eating disorders as well. So it's unique to us in that depression also is twice more common in women than in men.
Wow.
So we have a lot of unique circumstances as females and as women that we deal with.
So let's talk about how you can recognize suicidal ideation in women specifically, because we've spoken to some of your colleagues about how to recognize it in men, how to recognize it among the elderly. What sort of specific triggers, are warning signs for women?
So like I mentioned previously, depression is far more common in women. And most persons who commit suicide actually are depressed or suffering from some substance abuse. So we need to look out for those warning signs, the warning signs of depression, because it is twice more likely in women than it is in men. So you would look for that person withdrawing or isolating. They become more irritable. They may not be sleeping. They may not have much of an appetite. They let go of their hygiene. Like, as women, we take care of ourselves, especially as Bahamian women, right? And that person has no desire to fix their hair, get dressed for work. They may snap at their children, snap at their spouses or friends. And then all of those things are signs as well. They lose interest in things that they once were interested in, such as, say, if they enjoy going running or dancing or church groups. They're no longer interested in those things anymore. They may be crying a lot as well, and they feel sad and hopeless almost always.
Let's go back to something that you talked about, some of the very unique things that women experience, childbirth and the imbalances in hormones that impact us during those times. How do you recognize, baby blues versus suicidal ideation?
Excellent question, and thank you for asking. So baby blues occurs actually in 30 to 75% of women, and it is completely normal, right? But it usually resolves within 3 to 5 days. Sometimes it may take up to 2 weeks. But if it persists longer than that 2-week period and they're having trouble and challenges for weeks and months, then that's something that we need to look into.
And in cases where women might be experiencing that sort of prolonged sadness, what resources are available to them locally?
So locally, we have numerous resources available. Your OBGYN, who you were intimately involved with and should be comfortable talking to, you can reach out to them, and that person can write a referral either to a private or to a public psychologist or psychiatrist. We have the community counseling center available on Collins Avenue, With that referral, you'll get an appointment date and we can resume counseling and get you the help that you need.
And what does that help usually look like for women specifically?
So, with postpartum depression, you don't have to be fearful of being medicated. Talk therapy initially, counseling, cognitive therapy initially. So, we talk to you about what's going on in your thoughts, your behavior, your mind, and we give you exercises and training to combat and correct that behavior.
If you had advice to give to a woman who might feel themselves struggling, or to, friends and family members who might be concerned about their loved one in terms of getting them help for a mental health issue or a mental health disorder, what would that advice be?
That you are not alone, that depression and mental illness is very common, even more so after the pandemic. Worldwide, persons are struggling with their mental health and their wellness. Unique to the Bahamas, we experienced Hurricane Dorian, and a lot of individuals are still suffering from depression and post-traumatic stress from that. So I would encourage you to know that you are not alone. Other than heart disease, the global burden of illness, depression is second in the world.
Wow.
Depression is number 2 after heart disease. So you have nothing to be ashamed of. It is very common, and we are here to help you. And as women, we go through things that men do not experience. They could never imagine, and we are here to assist you.
Well, thank you very much, Dr. Forbes. This has been a very insightful conversation.
Thank
you so
you.
much. We have more from the Suicide Prevention Series in a moment. Are you or someone you know struggling with suicidal thoughts or ideations? You don't have to go it alone. You can reach out for help. Call the Crisis Center at 328-0922, People Helping People at 698-0155, the mental health professionals at the Sandlands Rehabilitation Center at 364-9600, or the Community Counseling and Assessment Center at 323-3293.